When you hear the word radiation in cancer care, your mind probably jumps straight to one thing: finding a cure. But what if one of its most critical jobs had nothing to do with that at all? Today, we're diving into the powerful and I think really unsung world of palliative radiation.
Right? We always think of radiation as this big weapon, this all-out assault on cancer. But what if its biggest, most profound impact is actually found somewhere else? Asking this question forces us to look at this amazing technology through a totally different lens.
So, to really get this, we got to start with the basics. What exactly is palliative radiation? Let's break it down.
Okay, so palliative radiation therapy, or RT for short, is all about a huge shift in focus. We're not trying to obliterate the cancer anymore. Instead, the number one goal is to manage the effects of that cancer on the person. We're talking about relieving pain, easing pressure, and just flat out improving their quality of life. It's a powerful move from a philosophy of cure to one of care. Theory is great, but honestly, the true impact of this approach is way easier to see in the real world. So let's open up our first set of case files and see how it's used to tackle two of the biggest challenges patients face: just debilitating pain and really dangerous pressure. So let's meet our first patient. He's a 62-year-old man, and the cancer has unfortunately spread to his bones. He's dealing with constant, severe hip pain. I mean, an 8 out of 10, that's the kind of pain that just takes over your whole life. You can't sleep, you can barely walk, and the usual painkillers just aren't touching it. So why bring in radiation here? Well, the logic is actually incredibly straightforward. You can think of it like a three-pronged attack. First, the radiation beam acts like a targeted strike, shrinking the tumor that's causing all that pain. Second, this often brings relief way faster than other options. And third, and this is so important, it actually strengthens the bone, helping to prevent a future absolutely devastating fracture. And here is a fascinating, crucial insight. The patient often starts to feel better, sometimes within just a week or so, long before a new scan would show any visible change in the tumor's size. And that really gets to the heart of palliative care. The focus is on how the patient is feeling, on their experience, not just on what the pictures are telling us. All right, now let's switch gears to a totally different kind of problem. A man with lung cancer shows up with some really alarming symptoms. His face is all swollen, and he's really struggling to catch his breath. This is a classic textbook case of something called superior vena cava syndrome, or SVCS. So what's going on here is basically a plumbing problem. A tumor is literally squeezing shut the superior vena cava. That's the huge vein that brings blood from your upper body back to your heart. Palliative radiation is the perfect tool for this job. It shrinks that tumor down, it relieves that physical pressure, and boom, the swelling goes down and the patient can breathe easily again. Now, palliative radiation isn't just about managing ongoing symptoms. In our next set of cases, we're going to see how it becomes an absolutely critical, time-sensitive tool in neurological emergencies. We're talking situations where a person's ability to move and sometimes even their life is hanging in the balance. Okay, listen up. When a patient with cancer shows up with this specific trio of symptoms, back pain, weakness in their legs or arms, and bladder problems, that is a 5-alarm fire in the oncology world. This is the siren for metastatic spinal cord compression. A tumor is pressing on the spinal cord itself, and literally every minute counts. And this is where speed is everything. Getting radiation started immediately is all about preservation. See, we can't always reverse paralysis once it's already happened, but treating it super fast can stop the damage in its tracks and save a person's ability to walk. The goal is to preserve whatever function they have left. Now, when cancer spreads to the brain, the game plan changes completely depending on what you're facing. If you've got lots of little tumors scattered all over, the priority is getting those symptoms under control fast. For that, you use a technique called whole brain radiation therapy, or WBRT. But if you only have one or two isolated spots, the goal shifts. You want long-term control while protecting as much of the healthy brain as possible. And for that, you use a super precise method called stereotactic radiosurgery, or SRS. And there's a really powerful way to remember the difference. SRS preserves the brain, WBRT treats the brain. See? SRS is like a sniper shot, taking out the target while preserving the surroundings. WBRT is more like casting a wide net to manage disease that's all over the place. The choice is all about what's best for that particular patient at that moment. All right, for our final case file, we're looking at a scenario where palliative radiation isn't just about quality of life, it's about literally saving life, right here, right now. So picture this.
A 50-year-old woman is rushed to the emergency room. She's bleeding, a lot, directly from her tumor. They check her hemoglobin, which measures your red blood cells, and it's at 6.5. Now, to put that in perspective, that is critically, life-threateningly low. In a crisis like this, radiation is used for something called a hemostatic effect. Hemo for blood, static for stopping. It's radiation that stops bleeding. Just a single, well-aimed dose can be absolutely life-saving. It basically causes the fragile blood vessels in the tumor to clot up, stopping the hemorrhage, often in just a matter of hours. It's an unbelievably powerful way to stabilize a patient and buy precious time. So we've walked through all these different, really intense scenarios. Now let's try to pull it all together into a simple playbook, kind of a master's summary of the goals and the tools for each situation. And this playbook really lays it all out, doesn't it? For every single scenario we've talked about, from bone pain to that scary cord compression, there's a very specific goal and a tailored radiation plan to match. And if you look at that dose column, you can see just how customized these treatments are. A single, powerful shot might be all you need to stop bleeding, while a longer course of treatment is needed to preserve spinal function. It's all about being precise, effective, and totally focused on the patient's immediate needs. And that really brings us to the core message of this whole explainer. After seeing all of this, what is the single most important thing to understand about palliative radiation? It's this. Palliative RT is not lesser radiation. It's not a consolation prize or what you do when nothing else can be done. It is a proactive, compassionate, and incredibly sophisticated field that is all about improving a person's life right here and right now. You could say it's radiation oncology at its absolute most humane and impactful. We've seen how this entire field shifts the focus away from the disease and back onto the person. And that leaves us with a much bigger question to think about. Across all of medicine, what does truly patient-centered care really look like?
Thanks so much for joining us for this explainer.